This video is not medical advice. If you are seeing a psychiatrist, psychologist, or therapist, continue with your therapy. Show them this video and let them make any changes to your therapy. This video is a discussion on the deadly dangers of modern academic and American Psychological Association adaptation of an erroneous linguistic psychology of emotionally driven behavior and emotional control, regulation, and management, first inscribed in Homer's Iliad nearly 3,000 years ago. For citation references and additional discussion and material on self-empowering and healthy cognitive emotional reprocessing therapy, please visit my website at symbioticpsychology.com. The very first sentence in Homer's Iliad lays the emotional linguistic foundations for today's evidence-based but flawed cognitive behavior modification therapies. Goddess, sing me the anger of Achilles, Peleus' son, that fatal anger that brought countless sorrows on the Greeks and sent many valiant souls of warriors down to Hades, leaving their bodies as spoils for dogs and carrion birds. For thus was the will of Zeus brought to fulfillment. Achilles' anger brought countless sorrows. Achilles' anger sent many valiant souls to Hades. In Homer's text, the emotion of anger is causal. That is, anger is the cause of Achilles' behavior. This erroneous cognitive linguistic construct of the mind continues to this day. Beginning with our primary and secondary education in language and literature, emotionally driven behavior has become an unquestioned foundation of modern evidence-based psychological therapies. Mistakenly, current psychological therapy understands emotion as potentially aberrant and dangerous because it holds that emotions, moods, attitudes, and feelings change the neurological and biochemical physiology that drive destructive behavior. Therefore, and incorrectly, these emotions, moods, attitudes, and feelings must be controlled, regulated, and managed, and if necessary, even with pharmaceuticals. Because 3,000-year-old emotional linguistics in language and literature have misled the psychological community into believing that aberrant and dangerous emotions can lead to destructive behavior, emotions are not to be trusted. To the patient's detriment, cognitive behavior modification therapies ignore emotions' evolutionary role to reprocess disempowering and negative, bad-feeling cognitive behavior into empowering, appropriate, healthy, and good-feeling cognitive activities, responses, and behavior. Cognitive behavior modification therapies include rational emotive behavior therapy, cognitive behavior therapy, mindfulness, mindfulness-based cognitive therapy for depression, eye movement desensitization and reprocessing, forgiveness therapy, positive psychology, emotional intelligence, interpersonal psychotherapy. All of these therapies advocate for emotional control, regulation, and management, even with pharmaceuticals, and ignore emotions' evolutionary function to reprocess cognitive activities and behaviors. But what is emotion? Do emotions really drive behavior? If emotions don't drive behavior, what does? What are emotions? Emotions, moods, attitudes, and feelings are the knowing and awareness of feeling good and feeling bad, perceptions of neurological, biochemical, and physiological changes in states of being within the brain and body precipitated by cognition. The cognitive emotional cause and effect process flowchart. Starting at 1 on the left middle, an object of attention stimulates cognitive activities of awareness and knowing, such as perceiving, conceiving, remembering, reasoning, judging, imagining, and problem solving, which precipitate neurological, biochemical, and physiological changes in states of being in the brain and body that 4, drive behavior, and 5, are perceived by consciousness as good or bad feeling emotions, moods, attitudes, and feelings. Our language and literary linguistics of emotionally driven behavior is a conceptual shortcut that does not acknowledge the role of changes in physiology of the brain and body that drives behavior. Our brain and body is an electrobiochemical unit that generates a highly orchestrated set of electrobiochemical charges that are sent out from the brain and through our nervous system and are causal to the physical movement, motion, and behavioral acts. Depression is not an emotional disorder because cognition, non-emotion, precipitates the neurological, biological, and physiological changes in states of being. Emotion is the perception of these physiological changes, and as such, is a necessary foundation of all evidence-based cognitive behavior modification therapies. Since depression is a perception of physiological changes in states of being precipitated by cognition, depression is a cognitive disorder. What is the evolutionary function of emotions? Emotions, moods, attitudes, and feelings are the good or bad feeling perception of neurological, biological, and physiological changes in states of being precipitated by cognition. Positive, good feeling emotions, moods, attitudes, and feelings have an evolved correlation with health, well-being, and successful decision-making prowess. Negative, bad feeling emotions, moods, attitudes, and feelings have an evolved correlation with their negation. If this were not so, our prehistoric ancestors were not likely to survive to adulthood, where they would pass on their genetic code to the next generation. Good feeling emotions, moods, attitudes, and feelings have an evolved positive correlation with health, well-being, and effective decision-making prowess and their actualization. Negative, bad feeling emotions, moods, attitudes, and feelings have an evolved correlation with the lack of health, well-being, and effective and successful decision-making prowess and their actualization. Good and effective decisions and their actualization cannot be made in a vortex of negative emotions, moods, attitudes, and feelings. Emotions have not evolved to be controlled by cognitive behavior modification techniques. Emotions have evolved to serve as a biofeedback mechanism and assist the individual to reprocess, restructure, and redevelop their own disempowering, bad-feeling cognitive activities and behavior towards empowered and good-feeling emotions, moods, and feelings that signify a healthy and robust state of neurological, biological, and physiological being. Looking at our evolved and self-empowering cognitive emotional reprocessing mechanism, starting at 1, over on the middle left, 1, an external or internal object of attention stimulates. 2, cognitive activities of awareness and knowing, which precipitate. 3, physiological changes in states of being in the brain and body that. 4, if perceived as negative feeling, bad emotions, moods, attitudes, or feelings, please go to number 5. Negative, bad feeling emotional states stimulate. 6, new cognitive reprocessing activities of awareness and knowing, which precipitate. 7, new healthy and empowered physiological changes in states of being in the brain and body that. 8, drive behavior, and 9, are perceived as good feeling emotions, moods, attitudes, and feelings. Cognitive emotional reprocessing education is necessary to empower an individual with the skills, tools, and understandings they need to cultivate and maintain their own health, well-being, and successful and effective decision-making, and their actualization. Cognitive emotional reprocessing health education is a must in education, social service, mental health, and criminal justice reform. Every individual must understand and utilize their own evolved, self-empowering cognitive emotional reprocessing mechanisms. Preschool, primary, and secondary language and literary educators are linguistically indoctrinating our children with an erroneous psychological theory of emotionally driven behavior, dysregulation, and control, based on the emotional linguistics of Homer's Iliad, inscribed almost 3,000 years ago. The dysregulation of cognition, not emotion, is causal to the aberrant changes in an individual's neurological and biochemical physiology that leads to suicide, depression, psychotic mania, and dysfunctional neurological and biochemical physiology susceptible to disease and illness. Depression is not a mood disorder. Depression is a cognitive disorder. Evidence-based cognitive behavior modification therapies work because cognition, not emotion, changes the neurological and biochemical physiology that is then perceived as emotions. The current erroneous linguistic education of emotional behavior by our primary and secondary school teachers and the flawed science of emotional dysfunctional theory and control utilized by today's psychiatrists, psychologists, and therapists necessitates the following 8 warnings. 1. Denial of emotional biofeedback control mechanism. Emotional disorders such as depression, anxiety, suicide, mania, bipolar disorder, borderline personality disorder, attributed to emotional dysfunctional theory are not, quote, emotional disorders, but cognitive disorders that deny an evolved emotional biofeedback control mechanism. Because of a belief in emotional control, management, and regulation, the neurolinguistic influence of, quote, emotional dysregulation on a person's neurological and biochemical physiology convolutes emotion's evolutionary role to pivot off emotionally negative cognitive behaviors towards emotionally positive cognitive behaviors and its resonating outward expression and behavior. If emotions are deemed untrustworthy because of a false belief that aberrant and dangerous emotions drive behavior, the emotional biofeedback and control mechanism is further sabotaged in fulfilling its evolutionary role. The emotional roller coaster ride provided by the entertainment industry through such mediums as movies, television, books, songs, and music is dependent on a certain denial of the evolved emotional biofeedback and control mechanism to reprocess cognitive activity towards well-being. This suspension of emotional understanding can bleed into daily life and disrupt emotion's role in guiding cognitive behavior, critical analysis, and effective decision-making. Warning 2, camouflaged aberrant cognitive behaviors. Any psychological or pharmaceutical therapy that inhibits a person's natural and evolved cognitive emotional correlations can camouflage aberrant cognitive behaviors normally exposed through emotional dissonance. These unabated cognitive behaviors can continue to change neurological and biochemical physiology until they disrupt uncontrollably into dangerous psychotic, suicidal, and schizophrenic behaviors. Modern psychology and research attributes the power of causality to emotions without integrating a person's capacity to reprocess cognitive behavior that solicits other emotional responses. If these emotions stemming from an, quote, emotional disorder are managed pharmaceutically, science is again usurping emotion's evolutionary role in accentuating aberrant and destructive cognitive behavior to an individual's conscious attention and awareness. Warning 3, unrecognized defense against illness, infections, disease, and injury. Neurological, biochemical, and physiological abnormalities that are emotionally perceived may not originate from psychological cognitive activities. Instead, they may be attributed to illness, infection, or disease. However, by an individual consciously working to feel good, their body utilizes another evolutionary defense for survival. Feeling emotionally good has an evolved correlation with a robust and vigorous physiology. Therefore, evolution has set up another layer of resistance to fight off illness, affection, and disease if an individual consciously works to feel good rather than succumbing to emotionally negative physiological activity. People who have developed their cognitive emotional reprocessing abilities, tools, and understandings to maintain good feeling emotions, moods, attitudes, and feelings empower themselves to survive illness, infection, disease, and pandemics. Good feeling emotions promote a healthy physiology. In addition, athletes depend on their mental and physical prowess, strength, and stamina, which have an evolved correlation with good feeling emotions, moods, attitudes, and feelings. If an athlete is ignorant of or indulging in their bad feeling, negative emotional awarenesses of weakened physiology, they are prone to injury and substandard performance during practice and competition. Warning 4, misguided actions upon an external world. If an individual or patient is never taught, 1, how to use their cognitive emotional biofeedback control mechanism, and 2, that good and bad feeling emotions, moods, attitudes, and feelings are about their own cognitive activities, and 3, how these good and bad feelings have evolved correlation with the health and well-being of their neurological and biochemical physiology, or 4, even more detrimental, is taught to ignore, constrain, or inhibit their evolved emotional biofeedback mechanism, they will continue to associate and give credit or fault to the origins of their emotions, moods, attitudes, and feelings to an external world. For them, feeling good or bad is not about what I am doing. That is, I feel this way because of what they, the external world of circumstances, events, and happenings, are doing to me. And if they do this to me, how can I act other than what I experience? We live in a world that validates fault to those who make me feel this way. Feeling good has become about changing, controlling, or accepting or acting upon them and the external world, and to punish those who make me feel angry, depressed, or wrong, just as religion, media, law, and personal experience have taught and continue to teach. Warning 5, misguided, feels good, is good morality. Because joy has evolved correlation with health, well-being, and success, we have evolved to be joyous beings. Yet a self-centered, feels good, is good morality must be tempered with a compassionate awareness of the symbiotic connection between all humanity. Rather than rigorously adopting and adhering to a set of religious, political, academic, and culturally defined set of beliefs and understandings that deny an individual's education and development of our evolved and self-empowering cognitive emotional reprocessing mechanism, our educational institutions must teach, develop, empower a feels good, is good cognitive emotional reprocessing dynamics that can rationally and comprehensively debate the moral dilemmas facing each new generation. Warning 6, literacy can adversely affect natural cognitive emotional development. The current linguistic semantics of emotional behavior depicted in secular and religious literature reinforces a self-indulgent, reflexive behavior driven by emotions. This animalistic portrayal of emotional behavior ignores any conscious cognitive emotional reprocessing of cognitive activities towards better feeling, healthy, and successful cognitions. To enjoy the thrill and excitement of any fantasy world, and to understand and comprehend the more complex emotional behaviors within the intricacies of some advanced character and plot progressions, a reader must be even more willing to suspend their disbelief and accept a self-indulgent reality of emotions driving behavior. Literacy becomes problematic when natural cognitive emotional reprocessing developed is usurped by a singular reality of reflexive and self-indulgent emotional driven behavior, void of any reprocessing skill, education, and training. Warning 7. Justice based on falsehood is itself false and unjust. If law is ignorant of what drives human behavior and decision-making, how can there be but laws of ignorance and injustice and disorder, conflict, and crisis? The mental skills and agility that most people feel have developed since birth to navigate successfully through the societal nuances and intricacies of what feels good and what feels bad is mainly absent in the millions of incarcerated people. Here, as a result of reinforcement of negative thought patterns, along with a misunderstanding of emotions as a biofeedback mechanism to promote health, well-being, and success through cognitive emotional reprocessing, their cognitive behavior has never moved up the emotional staircase into the pleasures of successful and compassionate decision-making and living. Any successful and sustained rehabilitation is dependent on understanding the brain's neuroplastic nature by our teachers, our parents, our schools, our religious figures, and by our politicians who are blindly setting up rules and laws of punishment that only further degrade human intellectual and emotional wisdom and well-being. Our criminal laws and justice are not designed to rehabilitate, but to punish, and our jails and prisons tend to reinforce the neuroplastic development of a dysfunctional mind. With the proper education, training, and beliefs, the neuroplastic brain can be rewired from emotionally negative decision processing that accentuates destructive behavior to emotionally positive decision processing that accentuates compassionate and rewarding, useful, and constructive behavior and results. Warning 8. Biased and skewed cognitive, emotional, and physiological research. What is the impact of an emotionally driven behavior and emotional control education that obscures an individual's skills, abilities, and beliefs to reprocess cognitive emotional behaviors have on experimental designs? How reliable are existing psychological dependent studies if variation within an individual's capacity for reprocessing, restructuring, and reorganizing one's own cognitive emotional dynamic towards health and well-being is unaccounted for? Feeling good cognitive emotional behavior must have an evolved correlation with an individual's health and robust biochemical and neurological physiology in the brain and body. Negative feeling cognitive emotional behavior, although in the short term is a necessary survival mechanism, in the long run, negative feeling emotions, moods, attitudes correlate with the negation of physical and mental health, well-being, and successful decision-making prowess. Because of this, research on human physiology in medicine is dependent upon an individual's psychological capacity to reprocess, restructure, and redevelop one's own cognitive emotional feelings, moods, attitudes to a healthier state of being. If this capacity is unaccounted for in experimental designs on human populations, how violent or biased and skewed are the results? Every individual has an evolved and human, apart from animal, cognitive emotional reprocessing control and regulatory mechanism. If this mechanism has been subdued, camouflaged, or even made ineffective through an erroneous emotionally driven behavior and emotional dysregulation, linguistic indoctrination, and education, and these variables have not been experimentally accounted for and factored in, and when 40%, 6% of all suicide deaths have a recognized mental illness, how reliable is evidence-based psychiatric, psychological, and pharmaceutical therapeutic science? Cognitive dysregulation understands that cognition, not emotion, changes the neurological and biochemical physiology that drives behavior. Therefore, cognition must be controlled, regulated, and managed. The emotional experience is the perception of good and bad feelings, neurological, biochemical, and physiological changes and states of the brain and body precipitated by cognition. A symbiotic relationship between emotions and physiology has evolved where good feeling emotions, moods, attitudes, and feelings correlate with a healthy physiology, and bad feeling emotions, moods, attitudes, and feelings correlate with an unhealthy physiology. Cognitive behavior modification therapies work because cognition precipitates the aberrant neurological and biochemical physiology associated with, quote, mood disorders. This cognitive generative physiology is perceived as negative, bad feeling emotions, moods, attitudes, and feelings. Cognitive emotional reprocessing behavior therapies utilize bad feeling emotions, moods, attitudes, and feelings to understand, restructure, and redevelop this existing unhealthy and disempowering cognitive activities towards empowering, good feeling, and healthy cognitive behavior. Rather than demonizing emotions as aberrant, destructive, out of control, and in need of regulation because of, quote, an emotional disorder, cognitive emotional reprocessing health education understands the emotions as an evolved sensory system, akin to the sense of pleasure and pain, giving consciousness feedback on the health and state of one's own neurological and biochemical physiology. Cognition, not emotions, precipitates the neurological and biochemical physiology of the brain and body that drives behavior. Instead of being regulated by cognitive behavior, emotions, moods, attitudes, and feelings are used to reprocess, restructure, and redevelop cognitive behavior and to enhance the individual's health, well-being, and successful decision-making prowess and its actualization. Because joy has an evolved correlation with health, well-being, and success, we have evolved to be joyous beings. Ancient Greek philosophers and today's academic dissertations of emotional suffering, slavery, and vulnerability exist only when cognitively dwelling upon the lack or absence of that which is wanted, desired, or intended. When these emotionally negative cognitive activities are reprocessed, restructured, and redeveloped into emotionally positive cognitions, a being of emotional suffering, slavery, and vulnerability is transformed, transmuted, and renovated into a being of joy, freedom, and power with the imaginative, artistic, and creative mind necessary to fashion and manifest their wanted, desired, and intended world, reality, truth, and favored fortune.